For years, doctors have recommended cortisone shots as a way to alleviate pain and symptoms associated with arthritis. Corticosteroids have strong anti-inflammatory properties which can help reduce inflammation and decrease pain. However, recent studies have called into question their effectiveness. For example, this recent systematic review and meta-analysis concludes that intra-articular corticosteroid injections offer pain relief only at the short term, with benefits losing clinical relevance after about 6 weeks. What's worse is that other studies are shining light on potential serious side effects of cortisone injections. Corticosteroids have been found to be chondrotoxic, meaning they weaken and damage healthy cartilage. Remember, arthritis by definition is the gradual wear and tear and loss of articular cartilage. So while cortisone can provide temporary relief and alleviate pain and symptoms, they result in further cartilage loss and eventually worse arthritis. In fact, that's exactly what this clinical trial showed. The results showed that among patients with symptomatic knee osteoarthritis, intra-articular cortisone injections, when compared with saline placebo injections, led to greater cartilage loss without any significant difference in knee pain relief. To make matters worse, recent studies have unveiled a concerning association between cortisone injections and rapidly destructive joint disease. This is characterized by progressive joint space narrowing, osteolysis, and collapse of the joint architecture. One study found a dose-response association between intra-articular hip cortisone injections and rapidly destructive joint disease. Higher dose injections as well as multiple injections significantly increase the risk. Additionally, other studies have found that each cortisone injection increases the absolute risk of undergoing knee replacement surgery by 9.4% compared to those who did not receive such injections. Of course, it is important to note that the associations mentioned do not establish causation. Some argue that individuals with more severe knee arthritis are more likely to receive additional cortisone shots and were destined to get worse arthritis to begin with. And of course, this is a valid perspective. However, what sets cortisone shots apart is the lack of similar effects observed with other common treatments for knee osteoarthritis. In fact, quite the opposite has been found. Several studies indicate that both platelet-rich plasma injections as well as hyaluronic acid injections have shown a potential to decrease the risk of requiring knee replacement surgery. The contrasting outcomes between cortisone shots and alternative treatments strongly support the notion that cortisone injections may indeed be causing more long-term damage. So I think it's evident that corticosteroid injections carry significant and real side effects, and all of this highlights the need for doctors to exercise greater caution when administering them. But I also want to be very clear. I'm not saying there still isn't a use for cortisone injections. In my opinion, 1 or possibly 2 cortisone injections in a specific body part is probably safe. For example, I still recommend corticosteroid injections in very specific situations. Consider a situation where a patient is suffering an arthritis flare-up but has a vacation planned with friends and family. In these cases, a cortisone injection can be a sensible option as it seeks to offer quick and effective pain relief, enabling the patient to enjoy their trip. However, upon their return, I recommend transitioning to alternative injection therapies. These alternatives may carry a lower risk of side effects and have the potential to offer benefits over a longer term.